Okay, good evening, everyone. My name is Patricia, and I'm going to be sharing my speech today. I'm going to be sharing a speech about safe staffing ratios. So, here we go. Now, imagine going to the hospital during the most difficult moment of your life. Now, imagine that your nurse is responsible for caring for 10 or more patients at the same time. Even though nurses want to provide the best care possible, having too many patients can make it much harder to meet everyone's needs. According to the information in my research, hospitals have faced ongoing problems with understaffing, and one example is the Morningside Emergency Department. When repeated findings showed that not enough nurses were available to safely care for patients over an extended period of time, this demonstrated how serious the issue become for um, safe staffing needs. Today, I want to be um, just giving you more information on what's needed to help improve patient safety, support nurses, and also to lead better clinical outcomes. So today I want to explain, what safe staffing ratios actually are. We want to discuss how they improve patient safety and nursing care, and we want to also describe the benefits and the challenges of implementing them. First, let's talk about what safe staffing ratios what they mean. So, safe staffing ratios refer to their number of patients assigned to each nurse during each work shift. The goal is to make sure that nurses are responsible for a manageable number of patients so they have enough time to assess patient needs. Also, administer patient medication and monitor patients' conditions in a safe manner. Professional nursing organizations, including the American Nurse Association in New York, they have safe staffing associations where they support nursing plans, which matters to patients because it helps provide better needs and better care. So this means staffing should not simply be based on the number of beds in a hospital, but how sick patients are and how can we care for these sick patients. Now, Now that we understand what safe staffing ratios actually are, let's discuss why they're so important. So research shows that hospital with better nurse staffing experience of fewer patient complications, fewer medical errors, and lower death rates. So when nurses are overwhelmed with too many patients, they're able to pay closer attention to each person's condition and recognize the problems before they become emergencies. Safe staffing also improves the overall quality of nursing care, and nurses have time to educate patients about their medical treatments and answer any questions from family members who may have to assist in caring for these patients. Patients often feel that they want to be more comfortable and more confident when they're speaking with their nurses, and they also want to have more time to listen and respond to patient concerns. So, in healthcare, communication is essential. It allows for better staffing and it allows for better communication across the healthcare team, let's just say. And also, while staffing ratios clearly benefit patient needs, they also have um, that impact on nurses in the healthcare organizations that we represent. So, reasonable patient assignments help reduce stress, burnout, and job dissatisfaction among nurses. Nurses is both physical and emotionally demanding, so when nurses consistently care for too many patients, they're more likely to become exhausted, which can affect both the health and the quality of the care that they receive and provide. So, with better staffing, also helps hospitals retain experienced nurses. When nurses feel supported and they have manageable workloads, they're more likely to stay in with their jobs instead of leaving to the next profession due to burnout. So while we, of course, we implement safe staffing ratios, and it's not without challenges, but hospitals still today struggle with nurse shortages, budget limitations, and costs of hiring additional staff. So, however, many experts do believe that investing in adequate staffing can actually reduce healthcare costs over time by preventing complications and reducing hospital readmissions, improving patient outcomes. And although improving staffing requires commitment and resources, the long-term benefits for the patients, nurses, and the healthcare organizations make it a worthwhile investment. So as I conclude, let's just take a moment to review what I've talked about today. First, I've talked about what safe staffing ratios are and what they mean. Second, I discussed how safe staffing ratios basically affect the quality of nursing. And also, I described the benefits and the challenges of implementing these safe staffing ratios in the actual healthcare settings. Um, Safe staffing ratios are essential for delivering safe and effective patient care. They help manage the workload, reduce the risk of medical errors, and improve patient outcomes and decrease overall burnout. So, as future nurses, we just want to understand what that means and what safe staffing actually does for us. So thank you so much for listening. I appreciate your time, and I hope you learn more about safe staffing ratios because it's important to me. Thank you.